Hello friends, myself Dr. Devashish Mukherjee. I am a homeopath. I have worked as a senior research fellow in Central Council for Research in Homeopathy and Central Institute of Psychiatry for a period of 3 years, 4 months. Today I am going to discuss about an important medicine, phosphoric acid. First of all, let us know about the sphere of action of phosphoric acid. Phosphoric acid acts on central nervous system. Phosphoric acid acts on digestive system. Phosphoric acid acts on blood. Phosphoric acid acts on bones. And phosphoric acid as a whole produces debility and weakness in the organism. The one word or essence of phosphoric acid is debility or weakness. पेशेंट में बहुत ज्यादा वीकनेस रहता है, शारीरिक और मानसिक वीकनेस. There is weakness of memory. If you talk to a patient of phosphoric acid, he will look at you and as if he wants to recollect what he has to say. After a long time, he will respond and he will answer to you. Whenever you find such type of patients, you have to take the history very nicely, because you will find that there was some mishap or there was some incident in the family. For example, death of some near or dear one, or there is mortification, the patient has been humiliated, or there has been a failure or something like that in the family, which affected the mental of the patient, which affected the patient very much mentally. And as a result, the patient has become apathetic, indifferent to everybody, especially to the family members, to his occupation and everything. You will find that such patient who was very active and used to take a lots of responsibilities will sit in a chair for a long time and he will not talk to anybody. If you ask him, he will give response in a very slow manner. Apathetic, indifferent. Indifference means doesn't take interest in his daily activities or anything. He is disinterested. You will find that the patient, there is weakness of memory also. If you will open the book of synthesis repertory, you will find that phosphoric acid is in first grade in the rubric indifference, and also in weakness of memory also you will find that there is phosphoric acid. Whenever you have to study the materia medica, at this side wise you study repertory, you open the symptoms of materia medica and you compare with the symptoms of repertory, so that you could understand and select the remedy very easily and quickly during your practice. Next, let us know how it works on digestive system. You will find the digestive system, the phosphoric acid acts on digestive system. The patient is unable to digest anything, and there will be vomiting also. There is heartburn. The patient complains that he cannot digest anything. Even the simplest food he cannot digest. And there is diarrhea, which is profuse and watery and whitish in color. If you find all these symptoms, you can think of phosphoric acid. The central idea of phosphoric acid is weakness. It acts on nervous system, and you will find that the patient is very much apathetic and indifferent, as well as it acts on pancreas also. So it is being indicated in the patients who are suffering from diabetes mellitus, and some doctors such as Dr. Jhar and Dr. Hughes and all has written in his book that phosphoric acid works well in diabetes insipidus also. So whenever you see a patient who is passing a lots of urine, he has to wake up at night for several times, and urine has a sediment which is whitish in color and is offensive, and the patient is debilitated, patient is weak, the patient, there is emaciation, there might be cancerous symptoms. If you find all these symptoms, you think of phosphoric acid. In previous days, the phosphoric acid was indicated in typhoid fevers, where the patient was very weak and used to pass lots of blood in the urine, in the stool and urine. In such cases, the patient was very weak, apathetic. If he was asked any question, he was not able to answer properly. He was in a stuporous condition. If you will find all these symptoms, you please think of phosphoric acid. I hope my lecture would prove useful to the young doctors and young practitioners, also young practitioners, doctors and students. So thank you. And many doctors are asking to start a course on homeopathy. I am trying my best. I am trying to deliver my best to the people so that they can help, so that my lecture could help them to be a successful homeopath. Thank you. Thanks for watching.